Okay, so we're going to run through how to do a health check on a dog. The first things you need to be aware of before you even start is make sure you're wearing the correct PPE, so make sure you've got a clean scrub top on, get your hair tied back, make sure you've not got any nail polish on, especially if you're videoing this for evidence. We want to make sure that you've got the correct attire on before we even start. And then another really good idea before you even lay hands on the dog or the animal that you're doing a health check on is actually just to observe it for a few minutes. See what it's doing, see if it's doing anything strange, can you see anything obvious about that animal? What's its demeanour like? Is it behaving the way it normally should do? That'll give you some clues as to if there's anything you should be checking on and paying attention to. And also a good idea, if it's not your animal, to ask the person that does the normal daily routine looking after it, is there anything that they're concerned about? Is there anything that they've noticed? And have a look about where it's living. Can you see if there's any poo or pee there? Is there anything that we should be worried about there? Has it eaten today? Has it eaten normally? Is it drinking as it should? But now what we're going to do, what we're going to go through today is actually the physical exam, checking your animal. So you need to make sure it's restrained, and that might be getting somebody else to hold it for you. And if it's a bigger animal and you're going to lift it up onto a surface to check it over, make sure you don't do that on your own. If it's a bigger animal, that's a health and safety issue for both you and the animal. And then it's always a good idea as well to just check out, have a look, do you know this animal? Do we need to restrain it more firmly? Do I need to put a muzzle on perhaps? Am I going to get bitten? If I didn't know the animal, I would want to check that out first before I started. And then always have a plan. So start at the same place and work your way through. So I always like to start at the front end. So I'm going to start right at the very front, looking at the nostrils. I'm going to check and see whether or not we've got both nostrils are working. Is there airflow going through? Is there any discharge? Is there anything I should be concerned about looking at the nostrils? Have a look at her head and just try and see, are we symmetrical? Are there any lumps or bumps on one side that we don't have on the other? Because generally, if they've got symmetrical bumps, they're probably meant to be there. So check the nostrils, check the eyes, have a look, have we got any discharge? We can gently peel back the eyelids and have a look at the mucous membranes and see if they're a nice pink colour. And if I press on the eye, I will protrude her third eyelid. This is Tess. Tess has recently had an enucleation, so she's only got one eye, the other one has been removed. But I can tell you a bit more about that later. So check the eyes, see if we've got any discharge. And we're going to have a look at the teeth. So just gently lift the lip to see whether or not we've got how clean our teeth are, whether there's any tartar, and have a look at the gum colour. Now she's got pigmented gums, but we can see there is an area of pink. So I can do a capillary refill time. I can see what colour it is, and then I can press on the gum to blanch it and see how quickly the coloration comes back in, and that should be less than 2 seconds. So I can just do that, press, blanch it, see how quickly it comes back. And I want to check the other side as well and make sure, see if we've got any problems, any broken teeth or any issues. And then I'm going to want to actually have a look right down her throat and check her inside her mouth as well. And to do this, what you want to do is lift the head up, tilt it to the sky, put your fingers and thumb just behind the canine teeth, put your other finger of your other hand on the jaw and pull back, and you can have a good look down, have a look at the colour of her tongue and see what's going on. And if you do that, then your fingers are free from being bitten. Then I want to check her ears. So I want to check both ears. Good girl, good girl. Not quite sure what's going on. So I can look in her ear, I can look at the colour of her ear, I can look to see whether there's any discharge. And they're nice and clean. I want to look at both. And the other thing I can do is have a smell. So I can have a sniff and see whether there's any smells, and they don't smell of anything. And smelling is quite an interesting thing to do because it can give you an indication of if there's any infection, bacteria, because they smell a different if there's fungal infections. And then before I move back, I can actually check her lymph nodes as well. So remember, her submandibular lymph nodes sit just in the corner of her jaw, so if they were inflamed I would be able to feel them here. I can just feel tiny little P's but nothing else. And then her parotid lymph nodes sit just behind the base of her ear, at the temporomandibular joint. I can't actually feel those at all, so I'm not worried about anything, any infection. And I also want to have a look at her skin, see if there's any discharge, any lumps or bumps, and just have a good feel, work my way back. Push the hair up. She's a very short coated dog, so we can see the skin very easily. See if there's anything, and say work my way down, and I'll just pull her collar out of the way. If I work my way down her neck, the next lymph node I should be able to feel is the prescapular, which sits just in front of the shoulder joint. So if there was a problem with her neck or her forelimbs, I should be able to feel that enlarged, but can't actually feel it at all, so that's all fine. Work my hands down her legs. Has she got any lumps or bumps? Work my way down her front legs, again feeling for any lumps or bumps. And then I can check in between her toes. I'll just do a bum stop for herself because I've not got anybody holding her. We can check in between her toes, checking for little interdigital cysts. So quite often dogs can get little hot spots, little cysts in between their toes. So have a good feel to see if you can feel anything in there. And she says, please get off my feet. And we can also bend the limb back and have a look at the base, check the pores, check all the pads, see if there's anything going on. If I can get her just to stand up, good girl. What I can also do is, you sit down then, is actually just bend her legs, just give them a little bend and a little flex, and make sure that everything is working and she's not objecting or crying out. If anything was sore, she might cry out in pain there. Have a good feel under her armpits. She's got lymph nodes in her armpits and her axilla. And then again, feel all the way down. Have a good feel. Push the hair up to have a look at the skin. Might be a bit itchy. Give them a good scratch if they enjoy it. Keep your weight going down. Lift her up. This is a female dog, so I need to pay particular attention to her mammary gland. So I'm looking and feeling all down the mammary strip. See whether or not she's got any lumps or bumps under there. Check underneath, and then I can feel into her groin here. Would be able to feel whether she had swollen lymph nodes in her groin area. Feel all the way down, feel down her back legs. And sitting just behind her stifle joint, in the gastrocnemius muscle here, will be her popliteal lymph nodes. So if there was a problem with her back leg, these might be enlarged, so I can feel down there to see if there's a problem with that. And again, right down her legs, bend her legs, have a look between her toes, bend the pad, have a look at the base of her pads, and again the base of her foot, and also I can bend that back leg. Oh, bend your back leg, good girl, and see whether she's resenting that at all. And I can do the same with the other one, see if she's resenting it. And then I can actually pick up her back legs as well and just flex her hips and see whether she minds that, which she doesn't. Last but not least, have a check of her tail and have a look. Say we've got a bitch here, so I'm looking at her vulva, see whether there's any discharge, any swelling, anything going on that I wouldn't like to check. So you've had a good hands-on and a really good feel of all over the dog. Check for any lumps, any bumps, any swellings, anything at all, any discharge, and make sure that the skin under the coat isn't red or inflamed, there's no sore patches anywhere. Have a good check over and note down everything that you find. And the last thing we're going to do is you could take the rectal temperature, but we'll talk about that later on, because there's nothing wrong with this dog, and putting a thermometer rectally is slightly invasive if I've got no reason to do so, so I don't want to. But what I can do is I can check her heart rate and her respiratory rate and see whether there's anything, sounds I don't like. So I've got my stethoscope with the ends pointing forwards, pop in my ears, check to see it's on. You can move the end if it's not on. We want to make sure that end is rotated round. Good girl. There we go. And so I'm going to listen to her heart, get the kink out of it. I'm going to place that right on her chest, behind her elbow, and because she's just a little dog, I'm actually going to go centrally. And I can hear her heart. And so I can time that for 25 seconds, and then times it by 15 seconds, and then times it by 4 for a heart rate per minute. You can also listen to her chest. So remember that the chest area doesn't actually take up that much room. So her lungs are going to run in an area about here. So I'm going to listen to her chest, watch for her breathing. It doesn't help when they whine. And I can listen on both sides. And I should just be able to hear slight air movements going through her lungs. Good girl. And again, you can get a respiratory rate by counting how many breaths per minute she's taking. If you've listened to the heart rate, the other thing you can do is actually take the dog's pulse. And the easiest place to take the dog's pulse, and it's brilliantly easy in this little dog because she doesn't carry any extra weight, is on the inner thigh, just between the two muscles of the inner thigh. So as you run your hands back over the muscles inside their thigh, you can feel what feels like a string of spaghetti on this dog. It's about the same size as a piece of spaghetti. And if I just gently press my fingers in, then I can feel the pulse and count her pulse rate, which obviously should be the same as her heart rate. We should have a pulse for every heartbeat. So I can count that and come up with her beats per minute. And then last but not least, we can lift our little dog up on the floor and have a bit of a movement round and see whether or not she's moving or not. And thank you very much.